Hey guys, today I wanted to talk a little bit about what to do when you have a flare up or a relapse of your previous health symptoms. So, for me, I've had a little bit of a flare up here recently. I have a history of Lyme disease and chronic fatigue, some other issues for those that don't know. And I've had some issues here lately with some returning symptoms, pretty severe fatigue, some neurological issues, some digestive issues. So that's been a struggle for me here lately, but I just want to kind of discuss how I handle things like that. I've had several flare-ups in the past, and I'm sure people dealing with chronic conditions know what I'm talking about. So when you do have a relapse or a flare-up, generally it's going to be due to some type of stressor or a combination of stressors. So that could be physical stress or some kind of trauma. That could be mental and emotional stress. It could also be some kind of chemical stress, like something from your diet or environmental toxins. So typically, some type of big stress or combination of stressors there is what typically leads to a flare-up or relapse of previous symptoms and of your condition. I wanted to bring up the concept of what's called a stress bucket. So I've heard Dr. Dan Pompa and some others talk about this. So basically, this analogy means you have basically what's like a bucket, which is how much stress that your body can handle. So genetically, some people have a bigger bucket. Some people can drain the bucket better than other people, but that basically is how much stress your body can handle. Is that analogy of the bucket there? And so when that bucket starts to overflow, when you start to get more stress on your body, we talked about physical, mental, and emotional, chemical. When that stress starts to overload that bucket and be more than your body can handle or deal with, that's when you start to have those symptoms and you start to get sick and have those issues. So I always like to use that analogy for people. I think it kind of gives a good picture of what that's like. And like we were talking about, some people's bucket is bigger than others. Some people can drain that bucket better. So all really according to what your body can handle and what you're being exposed to. So when you have a flare up or a relapse, here's kind of what to do. So first off is don't stress over it. So stress obviously is just going to make the situation worse. Your body's not going to be able to heal when you're in that constant fight or flight sympathetic nervous system thing. You want to be in that parasympathetic rest and digest feel. So make sure you're not overstressing. Make sure you're getting plenty of rest and supporting your body with healthy foods, the supplements that work for you, the things that have worked for you in the past. Revisit that. See what may be able to support you here as far as rest. Make sure you're getting good sleep. Good quality sleep is very important for healing and restoration. And then see about identifying the factors. Certainly don't overanalyze and be constantly looking for maybe it's this, maybe it's that, because that's just going to cause more stress. But if you're able to identify certain factors, those stressors we talked about that maybe cause that flare up, you can identify and address that, and that's something that working with a practitioner can really help with as well. They can guide you on that, any testing you need to do, maybe kind of go through your history and your past to see where there may have been something that triggered that relapse or flare up. And sometimes it just takes time. I mean, just make sure you're living a healthy lifestyle, doing the right things, that work for you. And sometimes it just takes time, and your body will start to come back from it and heal and recover from that stress. Sometimes when you've had those stressors, like we talked about, wherever they're coming from, or a combination of things, sometimes it just takes some time for your body to bounce back from that and get everything back on track and get back into that healing and restorative mode. So I would say that that's good. Biggest thing is don't stress out about it. Don't worry. Don't live in constant fear, because that's just going to make the situation worse. I know it's frustrating. I've been on that roller coaster ride before where you feel better for a while and there's a flare up and you really can't identify exactly what happened. But I think not stressing out and not getting real frustrated over it always seems to help, and just maintaining hope. I mean, definitely hope. When I'm in that situation where I'm feeling positive and hopeful and really trusting God with my health, instead of stressing out about it and overanalyzing and try to figure everything out myself. I know I always do better and heal quicker when I'm in that relaxed mode, that restful, not stressed out and overanalyzing everything mode. So just some advice on how to deal with the stressor. And if you feel like you need some help, we're always here for you. If you want to set up a call, visit our website at hopespringfunctional.com. We'd love to help guide you through any health challenges you're dealing with, help you through whether you've just gotten sick and you have been frustrated trying to find answers, or you've had a flare-up or a relapse of a previous condition. We'd love to help you out. So check out our website, schedule a discovery call, or give us a call if you'd like to learn more, and we'd love to help you. Have a great day. I'll see you in the next video.